When it comes to a heart attack, every minute counts. And no, this isn't the kind of drama you want in your life. A heart attack happens when blood can't reach part of your heart because of a blocked artery. Each minute that passes, heart muscle dies. It's like a fire spreading while you argue about whether to call 911. So what does it actually feel like? Most people say it's not a sharp stab, but a heavy pressure in the chest, like an elephant sitting on you after a bad buffet. It can spread to your arm, jaw, back, or even your stomach. You might break out in a sweat, feel short of breath, dizzy, or just wrong. And here's the twist. Not everyone gets chest pain. Women and people with diabetes might just feel tired, nauseous, or have jaw or shoulder pain. Some women describe it as feeling like severe indigestion or a pulled muscle. So if something feels seriously off, don't walk it off. Call 911. Here's a real scenario. We're watching TV and suddenly your chest feels tight. Your first thought? It's probably just heartburn. You pop some antacids and wait. Big mistake. Instead, here's what you should do immediately. Call 911. Not your spouse, not your doctor's office, not an Uber. Emergency services. While you're waiting, chew an aspirin. Yes, chew. It helps thin the blood and can limit damage. Sit down and stay calm. Loosen any tight clothing. If you're with someone having symptoms, don't let them drive themselves to the hospital. Why the urgency? Because there's a treatment window, roughly the first 90 minutes. During this time, doctors can give you clot-busting drugs or perform emergency procedures to restore blood flow. After that window, damage becomes permanent. Now let's talk about why heart attacks happen. Over time, cholesterol and fat build up inside your arteries, forming plaque. Think of it like gunk building up in old pipes. If that plaque ruptures, a clot forms and blocks blood flow. That's your heart attack moment. What makes plaque rupture? Sometimes it's physical stress, like shoveling snow in freezing weather. Sometimes it's emotional stress, a big argument, shocking news. Sometimes it just happens. Who's at risk? High blood pressure, high cholesterol, smoking, diabetes, obesity, family history. These are the usual suspects. But here's what surprises people. Stress and lack of sleep are major risk factors too. Your body doesn't differentiate between running from a tiger and stressing about deadlines. Can you prevent it? Absolutely. Eat like you love your arteries. More veggies, lean proteins, whole grains, and fewer fried mysteries. That doesn't mean never eating a burger again. It means most of your meals should be good for your heart. Move your body. Even a brisk 20-minute walk helps. Your heart is a muscle. It needs exercise just like your biceps do. You don't need a gym membership or fancy equipment. Just move more than you sit. Quit smoking. Your heart and wallet will both thank you. Smoking damages your artery walls, making plaque buildup worse. Every cigarette is like throwing sand into your engine. And don't ghost your doctor. Regular checkups can spot early warning signs before disaster strikes. A simple blood test can show high cholesterol. A blood pressure check takes 30 seconds. These aren't luxury tests. They're basic maintenance. Know your numbers. Blood pressure, cholesterol, blood sugar. You know your phone number, your Wi-Fi password, your Netflix login. Know your health numbers too. Oh, and stress? It's not just in your head. Your heart feels it too. Chronic stress keeps your body in fight or flight mode. That means constant high blood pressure and inflammation. So breathe, stretch, or take a break. Scrolling bad news doesn't count as me time. If you've had a heart attack, recovery isn't just physical. Many people feel scared or fragile. That's normal. You just had a life-threatening event. Of course you're shaken. Join cardiac rehab if it's offered. It's not just about exercise. You'll learn how to manage your condition, reduce risk factors, and meet others going through the same thing. Talk about it with family, friends, or a therapist if needed. Take it slow. Recovery is measured in months, not days. Some people become depressed after a heart attack. That's actually common and nothing to be ashamed of. If you feel hopeless, anxious, or can't sleep, tell your doctor. And here's something nobody talks about enough: intimacy after a heart attack. Many people are scared to have sex. They worry it'll trigger another attack. Reality? Once you can climb 2 flights of stairs without chest pain, you're usually okay. But talk to your doctor about it. Don't suffer in silence. Remember, heart disease doesn't always shout. Sometimes it whispers. That mild discomfort you've been ignoring? That fatigue that never goes away? That shortness of breath you blame on being out of shape? Listen to those whispers. Your body is smart. It sends signals. The question is, are you paying attention? So if something feels wrong, even a tiny whisper, listen. That one call could save your life. And if you're reading this thinking, this won't happen to me, think again. Heart disease is the #1 killer worldwide. Not cancer, not accidents. Heart disease. But here's the good news. It's also one of the most preventable diseases. Small changes today can add years to your life tomorrow. So start today, right now. Check your blood pressure. Make that doctor's appointment. Take a walk after dinner. Put down the cigarettes. Your heart has been beating for you since before you were born. It's worked every single second of your life without a vacation. Maybe it's time to return the favor.